Okay, everybody, today we're going to be talking about why I am not your traditional chiropractor. So, if you've seen our socials, our Instagram stories, our website, or you've even stepped foot inside our office, then you know we see a lot of kids at Align Family Wellness. So, in this video, I want to share with you what makes our office pediatric focused, because it isn't just the toy room, the snacks, and the fun we have. There are 5 must-haves that we focus on that make us different from a traditional chiropractic office that allows us to get amazing results with even the toughest pediatric cases. Plus, we know you have friends and family who may live further away that you have recommended trying a pediatric chiropractor. This will help you and them know exactly what to look for when choosing just the right office. Okay. If you need help finding an office like ours, but you're in another state, we can help you. So if you check out pxdocs.com directory, it has over 500 pediatric and family offices just like ours around the world waiting for you to connect with them. Okay, so let's go into the 5 things to look for in a pediatric chiropractor so you know without a doubt you are in the right place. So this video is for moms specifically who want to have certainty that this is the right place for your child and family. You may have tried a chiropractor before, or you may have a different idea of what chiropractic is due to being adjusted as an adult or having a past experience. So we all know that no matter the industry, education is not everything in and of itself. But taking care of kids, and especially tough kiddos with chronic illnesses, can absolutely require additional training for the pediatric chiropractor that goes far beyond the spine, back pain, sports injuries, and all the things that I did for practically the last 20 years. So in order to really achieve proficiency as a pediatric chiropractor, you should have at least 80 to 100 hours of advanced training. Being actively involved in ongoing training still, we need to constantly be learning, improving, and finding ways to get even better clinical results. This is what I invest in each and every month on a consistent basis. I train in a network with hundreds of other pediatric chiropractors through the Pediatric Experience and PX Docs. It is the most advanced and focused training available in the profession right now for pediatric and family care, and I'm the only one in Central Illinois that's doing this. So, why have a high level of clinical experience? Well, first off, this does not mean that a child's pediatric chiropractor needs to have been in practice for a certain number of years or is a certain age. I've been in practice over 20 years, but for 20 years I was doing back and neck pain and I was unhappy, and I realized how happy I am taking care of kiddos, and we pivoted. We pivoted in COVID 2020, and we said we are going to focus on kiddos and families, especially in 2023. Now in 2024, we are going to explode. So some of the top pediatric and family chiropractors are really young, but they chose to focus on their advanced training in these high-level pediatric programs early on. But like me, I was in practice for 20 years. I have a ton of experience with just life and raising my own kids, and the things that I did wrong and the things that you should do as a parent that I wish I had done. And so I come with a little bit of age and a little bit of wisdom, also along with my great clinical skills. So many chiropractors have a big heart for taking on kiddos, and some put the word family in the name of their practice, but they see very few kids and still end up seeing mostly adults with back pain. Chiropractic is wonderful at helping adults with these things. It's so good. But it does mean that they likely don't have enough reps on taking care of kiddos with the most advanced levels like a pediatric chiropractor does, especially kiddos with chronic sicknesses, things like ADHD, autism, speech delays, chronic ear infections. Those are specific and take more than just your average, neck and back pain chiropractor. So another thing we utilize in our office is our pediatric insight scanning technology. We still rely solely on these exams to tell us what's going on with your kiddo. It has revolutionized my practice using an insight scan. This is amazing for people measuring their autonomic nervous system and their actual stress, and babies too when they can't tell us what's going on. We use a neurothermal, an EMG, and an HRV scan that are all without any sort of emissions. We can do them on a newborn baby, we can do them, on a mom, we can do them on a kiddo. Looking to make functional and long-lasting changes to neurology means two things. First, you have to have a baseline measurement to know what's going on. Then we put together a customized, personalized neurologic care plan and adjusting approach for that patient. Not everybody gets adjusted the same in our office. You also need to then utilize this technology to continually track and measure progress. That is what we love. Kiddos cannot tell us what's going on all the time. So we use these scans to measure and track progress and make sure I am doing the right thing to make your kiddo be the best that they can be. When we asked parents who previously saw other family chiropractors and didn't see the results that I wanted, was there any continuous progress exams or scans or way to measure? The answer is always no. There isn't. The Insight scans are top notch. One thing we really watch out for that is with your child's adjustments are pretty much exactly the same thing on repeat. If your pediatric chiropractor does not use this scanning technology, this is most likely the case where they're doing the same thing over and over and over. If we see something in a scan that maybe we're not clearing something correctly, we come at it differently with a different type of adjustment. This happens all the time. And then we remeasure and make sure that the kiddo is getting the best results possible. So we want to use a multitude of techniques, especially with what we call neurotonal approaches. So this can get kind of granular the way chiropractic works, but we get the best results and every single case is different. So each child has their own unique case history and different forms of birth trauma, toxins, illness, emotional stresses that are all affecting their nervous system. So if you do not consider all these factors and personalize the adjustment to that need, they're not going to get the results that they should. So I am trained in numerous chiropractic techniques. So we don't really just choose our favorite, we actually utilize them specifically to tell what the child needs to give them the best results. So when you have the right training and education on these techniques, you know what to use it when to get the best results. Some kids are getting, instrument adjusted. Some kids are just getting a little bit of just slight manual adjustments. Some kids are getting high velocity adjustments. It just depends on what your kiddo needs, and we talk through that. So the care plan is so important. Starting out with enough frequency and recommending enough duration. So this is maybe what you've dealt with before, is somebody is like, well, come back, your chiropractor's like, well, we'll do 3 times this week, then come back, we'll see how you do. We don't see how you do in our office. We create a customized care plan. I can look at your scan and I know exactly what your kiddo needs. I know how many adjustments it's gonna take and how long it's gonna take us to get there. So this can have a profound impact on their results. So if the care plan isn't enough, then they're not going to get the results they're looking for. So the care plan duration and frequency is pivotal, that we follow what we say we're going to do. So if a general family chiropractor doesn't have these advanced and updated care planning systems, and they recommend your child just comes once a week or maybe once a month, when we're really trying to make changes, you're not going to see much results. So then you're going to say chiropractic didn't work. That is the one thing that makes me so sad, because chiropractic works. It is amazing. It is life-changing. And maybe you just needed a more customized plan. Maybe you needed a little different type of adjustment. Maybe you needed to be in care a little bit longer. And that's okay. Just don't give up. Give it a second chance. Try someone else. So if you want to talk more about this, more about the specifics about what we do and how we're different, we'd love to chat with you. Most of our team are parents. Their kids come in and get adjusted regularly. They get adjusted regularly. My kiddos get adjusted regularly, whether it's here at home on my table or at the office. We would love to share our experience as a parent and how chiropractic has helped our families make a huge difference in their life. So if you have any questions, comment below, send us a DM, call us, call our office. We'd be happy to talk to you. We've got our care advocates ready to answer your questions. Share this video in other Facebook groups or with any mama that you know that needs to hear this. We've got articles linked on our Instagram. We've got all sorts of things we can send you if you need more information, and we would love to care for you and your family. So don't hesitate, give us a call and get started.